Hello and welcome to a special interview for The Wire supported by Glendivid Books. As the second wave starts to abate, we ask, how prepared is India for a third? Because the principal scientific advisor has already forewarned the country, a third wave is inevitable. To answer that question, I'm joined by a senior epidemiologist at Johns Hopkins Bloomberg School of Public Health and a member of the Johns Hopkins India Institute COVID-19 Response Task Force, Dr. Brian Wahl. Dr. Wahl, as the second wave is abating, I want to talk to you, in fact, about how prepared India is for the third for two reasons. A, people are already worried about the third. And secondly, the principal scientific advisor has forewarned the country that a third wave is inevitable. But before I come to the third wave, let me ask you about four factors that actually determine what is called the R number and as a result create a wave. In a recent article that you wrote for The Hindu, you summarize these four factors with the acronym DOTS. For most people who haven't read that article, that's a bit of a riddle. Would you begin by unraveling the riddle for me?
Absolutely, and thank you for having me on. So the R number, as you indicated, is the measure of, it's a measure of infectiousness for a disease. So if an R is above 1, it indicates that each infected individual is on average infecting more than one other individual. If it's less than 1, then an individual would be on average infecting less than one individual, and therefore we would see a decline in an epidemic. And there are really four factors that contribute to R over time. And these are, as you mentioned, summarized by the acronym DOTS. And if you will allow me, I'll go through each of those components, but maybe not in the order that they are in the acronym. So first is S, which is the proportion of the population that's susceptible to infection. So we need people who are susceptible to infection in order for an infection to take, or for an epidemic to take hold and to increase. O is the number of opportunities for a transmission event to occur. So we need people or groups of people coming together in order for transmission to occur. The probability of transmission as well is an important factor. And so given that there is an opportunity, what is the probability of transmission between an infected individual and a susceptible individual? And the last of the four components is the duration of infectiousness, or the D in the acronym. And this is important because the longer that someone is infectious, the more opportunities there are for them to infect others. If it's really short, there are fewer opportunities to infect others. And so these are the four contributors to R.
Before I go further, tell me, do all four have to happen together to create a wave? Or can 2 or 3 of the 4 be sufficient to produce a wave?
Absolutely, we do need all 4 factors. So if any of these 4 factors were 0, then we wouldn't have an epidemic. We wouldn't observe an epidemic. So for example, if there are 0 opportunities where people are, for infected individuals to come in contact with susceptible individuals, we wouldn't see anything. If there's a 0 probability of a transmission, again, we wouldn't see an epidemic increase. And so all 4 factors, to varying degrees, are important to observe an epidemic.
This is very interesting because what it suggests is that if you can successfully stop 1 or 2 of the 4, you can also stop the third wave happening. Let me, in that light, ask you a couple of questions. To what extent would carelessness in wearing masks, carelessness in terms of social distancing, mean that you are actually permitting a third wave to happen, or if it happens, permitting it to become a bad wave? Is carelessness therefore a problem? And conversely, careful observation of COVID behavior, could it stop a third wave?
Absolutely. So these are some of the best tools that we have to fight the pandemic. Social distancing, as well as mask wearing. And of course, we'll get to immunization as well in a bit, I hope. But if we look at this in the context of what's happening now, many parts of the country are beginning to relax their lockdown measures. Lockdown measures that were put in place in response to the second wave. And so because these are not permanent solutions, we do need to relax those lockdown measures. And as they are relaxed, it's really important that we continue to minimize social interactions wherever possible and continue to wear masks. Social interactions contribute to the O in the DOTS acronym, the opportunities for infections or transmission events to occur. And not wearing masks can also increase the probability of a transmission event given a contact, therefore contributing to that T component of the DOTS acronym. So I completely agree. Each of these, both of these factors is important for mitigating or at least, or potentially preventing a third wave.
So just to put that in layman's language, because I think it's important for the audience, they should understand that point. If they want to either prevent a third wave or at least limit and control its size, please make sure you wear masks all the time. Please make sure you social distance. That one simple act of observing COVID proper behavior can either prevent or at least limit a third wave.
Absolutely. And one other point, if I can just add to that, is when social interactions are unavoidable, continuing to wear masks, yes. If masks aren't feasible, or even if you are wearing masks, making sure that you're in a well-ventilated area, or even meeting outdoors can also help to limit transmission. I know it's quite hot and quite rainy in many parts of the country right now, but if we can focus on ventilation as well as meeting outdoors when possible, that would also help in mitigating or preventing a third wave as well.
So in other words, keep your doors and windows open all the time. Even if you're in an air-conditioned room, there's no harm in keeping a door or window open at the same time. And if you have to meet with other people, it's preferable to do it outdoors rather than indoors.
While continuing to wear masks and keeping distance from those individuals, yes.
A second answer that is in a sense inherent in what you said is that we must avoid large gatherings. That means we cannot do the mistake of permitting large political rallies, Kumbh Mela, Shahi Shnans, or in fact even large gatherings. Those are out. Otherwise, they will become super spreaders that will provide the opportunity for a third wave to either happen or escalate.
So we do know that COVID-19 is driven by super spreading, and it likely occurs probably at two levels. So one would be individuals. We know that there are individuals who themselves can be super spreaders, either for behavioral or biological or a combination of both factors. And we kind of we do need to better understand who those individuals are, but we also know that large gatherings can also help drive an epidemic. And we've known this really since the beginning of the pandemic. We saw this with the Diamond Princess cruise ship. We've seen it with studies in South Korea and Italy and other places. And so we should continue to avoid large gatherings. Even if they do become permitted, we should continue to avoid them. These also include things like weddings, crowded restaurants. It doesn't have to be these really large gatherings. Large gatherings can also include weddings and dinner parties and those sorts of things, and we should avoid those as well.
In which case, is there a case for saying that the Delhi government and several other governments as well have perhaps opened up too quickly, too soon? Was it a mistake at this stage to open up malls? Is it a mistake to open up restaurants even though they're limited to 50% capacity? Because these are indoor gatherings, there may not be ventilation, and clearly in restaurants, people will not be wearing masks. So was it a mistake to do this so quickly?
When to relax lockdown measures is a really difficult decision to make. It's important to remember that we are fighting an epidemic, a pandemic, and not a virus itself. And so we also need to be, considering things like the economy and getting back to life as normal, and making sure that populations that have been negatively affected over the last year are protected. And so, it's a really difficult decision to make. Despite that, I think restaurants and other places where people are gathering, we should focus on those measures that we were discussing earlier that we know help to prevent transmission, looking at ventilation, making sure that that people are wearing masks when possible, maintaining distance, those sorts of measures.
But what's your answer to the question? At the very first stage of unlock, did Delhi make a mistake permitting indoor dining in restaurants? Remember, Britain went through it in several stages. Indoor dining in Britain was only permitted recently. Before that, restaurants were permitted only if they could serve outdoors. Delhi has gone straight for indoor dining, so I believe has Maharashtra. Was it a mistake at this early stage?
I think we need to focus on I think opportunities to have dining outdoors, I think would help. And so I would consider outdoor dining as well. Whether it was the right time, again, is difficult because, nobody wants a lockdown, and we do need to be thinking about when to relax some of these measures. And the timing of when we start to relax is really difficult, and at the same time, we do need to be considering all options for minimizing transmission. And that would include focusing on ventilation, focusing on outdoor, allowing outdoor spaces to be open as well.
Okay, I can see you're being diplomatic and you're not giving me a clear answer. You're hedging by saying both things at the same time. Let me move to a concern to do with the letter D in DOT. That's the duration of infectiousness. Public Health England has recently released a report which says that, in fact, the Delta variant has mutated further, and now there is something called Delta Plus, or AY1, which is suspected to be more infectious because it's more virulent. Does that mean that we need to step up genome sequencing? And secondly, rigidly reinforce good COVID behavior? Both step up genome sequencing and make sure we don't drop our guard in terms of masking and social distancing.
So absolutely, the emergence of the Delta variant was an important contributor to the second wave in India. We know that it is much more transmissible. Each of those, well, at least three of those four factors in DOTS, the transmissibility, the susceptible population, and potentially the duration of infectiousness, have all been modified by the emergence of the Delta variant. And so the normal, the original Delta variant is alone cause enough for concern. The new AY1 variant, this is the Delta Plus variant, also known as B1617 sublineage 2.1, which is really a mouthful. So I'm glad we're using Delta Plus or AY1 instead of that long list of numbers and letters. But with the limited amount of data that we have on this new variant, it's difficult to say how worried we should be. But again, I think the Delta variant alone is cause enough for concern. But to your point, I think it speaks to the importance of having genomic sequencing surveillance in the country to be able to identify when these variants are arising, and using those data to then determine, is there an added level of transmissibility? Is there an added level of reinfections? Those sorts of things. So it's a harbinger of what could potentially happen as the variant, or as the virus continues to replicate. We know there's more opportunities for new variants to occur, and so we do need to be keeping an eye on those. And genomic surveillance is the best tool we have.
Now, one of the four factors that make up that acronym DOTS actually could provide a small ray of hope as we await the third wave. And that is the fact that the the proportion of susceptible people may have shrunk considerably as a result of the enormous second wave India experienced, particularly if the numbers infected are something like 20 or 25 times greater than the numbers detected. Would you agree?
So in general, as the number of susceptible individuals decreases, you're right. There's less of an opportunity for a massive surge to occur. There are a couple of complicating factors with this that I want to just maybe quickly highlight. So first would be exposure at the population level may not be homogeneous. So there could still be, if we're looking at, for example, a densely populated urban area, that level of susceptibility in that area might be completely different from a remote rural village. So that's one factor that kind of complicates this estimate of susceptibility. Some of the new variants, as I was mentioning earlier, have been shown to evade immunity. And so this also complicates how we calculate the susceptible population. In my opinion, there's really one very direct way to establish the proportion of the population that remains susceptible, and I think that would probably be the best way to determine what we might be looking at in terms of susceptibility and the potential for a third wave.
And that way is what? A serosurveillance survey?
Absolutely, that would be a sero surveys, and these can help in a couple of different ways. So first, they can help in telling us at a population level what proportion has some level of immunity to the virus, and this will indicate the extent to which a potential third wave might be feasible, and to what extent we might see, what level of what kind of peak we might see with a third wave. Second, and really importantly, and going back to that point on not having this kind of homogeneous level of susceptibility, serosurveys can also help us to identify pockets of susceptible populations and where they remain. And using those data, we can work to focus on potential susceptible populations as well, providing immunization and scaling up health systems capacities in those areas.
Now, I take it alongside a nationwide, effectively and efficiently conducted serosurveillance survey, one also needs to ensure mass immunization, because that also will further reduce the proportion of the susceptible population. And again, if both the serosurveillance survey and mass immunization can happen well before the third wave starts, you could succeed in limiting the third wave very considerably. The problem is, as of today, only 3.7% of the Indian population have had both jabs, and just under 16% have had one. So we're nowhere near the level of vaccination we need to be.
So vaccination has picked up in recent weeks, which I think is great, but I agree. We need to be dramatically increasing our immunization coverage. One important factor, though, I do want to point out is the estimate or the proportion of the population that's been fully immunized. This is a proportion of the entire population. So another important factor that is masked by these national level statistics is that vaccine coverage among those who are at greatest risk. So looking at vaccine coverage among older populations, those with comorbidities. I think we also need to be considering what those vaccine coverage levels are, because those are
the Hindu paper publishes those every day. I'm recounting from memory, but I believe the vaccine coverage of people over 45 is somewhere in the 40% range, 41, 42. Would you consider that effective and sufficient, or still short of what it should be?
So I think we're still rolling out the vaccine, and we need to be doing that faster, and of course we need to be increasing it further. And with the new variants, with potential new variants that may emerge that are more transmissible, I think we need to be getting vaccine coverage as high as possible. And so increasing coverage, especially among vulnerable populations, among at-risk populations, is incredibly important. So
tell me, at what level of vaccination do you as an epidemiologist believe herd immunity sets in?
So this is a really difficult number to specify. And if you go to the Hindu article that I wrote, you'll notice that I didn't mention herd immunity in there because it's not just a difficult number to specify, it changes over time. It's complicated by the fact that we don't have the homogeneity of susceptibility isn't there. We know that there are pockets of populations that are more susceptible than others, and so it's a difficult it's a difficult equation to look at. If you wanted to look at it in very simple terms, essentially what you want to do through reducing susceptibility is make sure that your R in a your R is less than 1. And so if you take a disease that has an R in a completely susceptible population of, say, around 8, which some people are suspecting could be the R in a susceptible population for this new variant, for the Delta variant, you would want to make sure that 7 out of those 8 people who you would have infected are protected. And so 7 out of 8 is around 88%. And so that's quite a high number. But those targets, that's just to illustrate that as the
can I stop you there? I don't want the audience to get confused in detail. This is a simple question.
Sure.
Do you have any sense of the proportion of the susceptible population that should be vaccinated before India can breathe a sigh of relief and say, I think we may have reached herd immunity? Or is it simply impossible to say what that proportion is? Which of the two?
It's impossible to say what that proportion is, in my opinion. However, that shouldn't deter us from trying to get immunization coverage as high as possible.
But the problem is, if you can't determine the percentage that qualifies as sufficient, then how high is as high as possible? You can keep carrying on till you get to 100%.
So ideally, we would get it as high as possible, including upwards of 100%. I think everybody deserves to be protected. The other important component to remember, we started off the conversation about whether or not each of these 4 factors was necessary for an epidemic to occur. So we can relax lockdown measures while continuing to socially distance, while continuing to wear face masks, while continuing to focus on ventilation, and in addition to that, getting immunization coverage as high as possible.
So what you're saying is, we do not have a percentage figure at which point herd immunity will work, because it's almost impossible to accurately define that figure for the many reasons that you've already spoken of. But keep vaccinating and ensure that you vaccinate as many as possible, because that is the best way of stalling a third wave or minimizing it when it happens. And at the same time, you're saying, ventilate even air-conditioned rooms, prevent large gatherings of all sorts, and wear your mask as often as you can, whether it's indoors or outdoors. All of that done together, the vaccination, the mask wearing, the ventilation, and avoiding large gatherings, all of that done together can either prevent a third wave or at least limit it.
Absolutely. I think we need all of these factors, and we need to, as we roll out the vaccine, focus on these additional factors that you just mentioned, even more so.
Dr. Wahl, thank you very much indeed. I think it will be a great help to the audience to know that there are certain simple things that each and every person can do that will contribute to either preventing or at least limiting the third wave. Keep your rooms well ventilated. Ensure you avoid large gatherings at all costs. Wear your mask as often as you can, even if need be indoors. and maintain social distance. But that also means, if you can, don't go to closed restaurants where there's a danger when you drop your mask that you could get infected. Avoid large marketplaces, particularly places like Lajpat Nagar where crowds are inevitable. A certain amount of common sense has to be used by every individual as they apply these guidelines to themselves. Is that right?
Yes, and get immunized when you can.
Thank you very much indeed, and get immunized as quickly as you can. Thank you very much indeed, Dr. Wahl. Take care. Stay safe.
Thank you so much.